Oh, good morning, guys.
Good
I got
morning.
to start by asking you, in your professional medical opinion, do you believe that the COVID-19 virus is a bitch?
uh, yes, she say that. Yeah, but most is correct. She's very correct. Is
Okay, so
What is she correct about?
uh, to use that terminology is really really
Oh, come
well.
on, Doc.
yeah, don't get tricked by
Is it
Bree.
or is it not a bitch?
Oh, I 100%. I would agree with that one.
All right. So we're gonna see this in the next Chamorro Medical Journal. COVID-19, the bitch, by Dr. Hoa Nguyen. An analysis.
we we'll be on CNN on that one.
Right, we would. All right. And like we said again this morning, I need to laugh. I think we need to laugh because we're heading into some very serious, we're already in some very serious waters, but with the next declaration, the governor we just got a message, 11:30 guys, press conference with the governor, and I know her whole team is, well, I think it's going to be with the governor because she's still sick, so I don't know how they're going to do it logistically. But Doc, you were in the physicians advisory group last night. This was a big meeting. A lot of people were in it. What can you tell us about what happened in that meeting and any of the decisions that we might be expecting this morning?
We have a big meeting yesterday. We have all the physicians there and public health, CDC. We have dentists there. So it's a lot of medical community there just to try to figure out what's going on. And we have in the past week or so, you can see that we kind of spiral downward very fast. And we all have to be concerned just because, hospitalization will coming up. I think we have, yesterday we have 8, now we have 9, and possibly have more in the next few days just because this hospitalization tend to be lag behind. So right now it's in the community, it's not no longer like before we have a cluster for the funeral, a cluster at a certain restaurant, but now that the in the community, so it's very dangerous how to try to contain this thing, because we are in August 14 today. Another 2 weeks or so, we're going to go into the flu season, and I know according to Dr. Joni Nagan, there's some admission related to the flu already in the hospital at this point. So the flu are here. So we really hold this aggressively to try to curtail this current cycle of the virus in the next 2 to 3 weeks or so before we get into the full flu season, because we're going to deal with 2 viruses. It's going to be a bear. So the question is, what do? We go to 2, we go to 1, and it's really very hard decision because we have to take into consideration of what the our economy is at this point. We try to open back up, and it's very hard to go backward. But sometimes we do not have a choice because we really have to take some aggressive action here. So we're talking about some P-Port 2 with some a lot of restriction because we really have to look at the area where we have the breakout. We have some cases coming out of a certain area, certain section of the business, and we need to make a recommendation for her to decide, what to do regarding to move forward. We have to move backward. There's no question about it. But the question is, which level do we move it back to? So it's just, but whatever we do is her decision of which level we go back to. But there should be quite a bit of restriction again on area that on location that we who have a breakout at this point. It's just a gathering. We might have to move back the gathering to much more than 25. Maybe down to 10 or less than that. So just because every time that we get together, the problem is that we drop our mask, and that's where the infection occurred. And I tell you, it does not discriminate against anybody. Um, so when we start to gather, even a small dinner with friends or whatever that is not on your same household good, everyone should know that they take a risk. And that's the problem because a day or two later, you figure out that one of the friends that you have dinner with turned positive. And that's where the whole thing start to spiral out of
Right.
control.
Uh,
So I know the possibility that we have probably over 500 contact, higher that public health had to chase down just because there's a close contact with somebody. And I say it's no longer the close contact of funeral or no longer close contact with certain restaurant. It's a close contact out there in the community. So yeah, we're not in the good time at this point.
mhm.
So
Y-
again, there's a lot of restriction we put there. We recommended, and I guess she have a press conference that she will release. So which one she think that she would agree with us in closing. But there's certain business there that we're going to close it down for about 2 3 weeks just for this cycle of the virus to be over.
Okay, so you're looking at a temporary rollback to PCOR 2 or PCOR 1. What was the final recommendation, though, from the PAG in terms of which PCOR are we looking at?
Yeah, most likely the people too were lots of restriction.
Okay, so
You know,
PCOR 2, there's a strong possibility that we may go back into PCOR 2, which is, there's the maximum restrictions for PCOR 1. PCOR 2 is minimum, or that's PCOR 3?
they can open up business with some restriction.
Okay.
People three business, with much less stringent on the restriction. But
Mhm.
again, we got to monitor a lot of business costs there that one that is really follow the rule, and unfortunately some are not. So we just have to not penalize everyone, but at a certain point we had to close down. Because I said we had to control this the next 2 or 3 weeks, or in September we're gonna be dealing with two different viruses. It's not good.
Mm-hmm. Okay, so yeah, PCOR 2 is moderate restrictions, but according to the
Yeah. So Doc, what's interesting
Shaolin
is I know that
Parahinemlu.
you guys had your meeting, but we understand the governor met with representatives from schools, and they were told that PCOR 1 is going to be implemented. So I know you're still a little, is it going to be PCOR 2 or PCOR 1? Do you think that there's still a chance that even though we have heard from people who heard it from the gov that it's going to be PCOR 1, is there still a chance that maybe PCOR 2 with some modified restrictions, or do you just don't know?
I mean, at a certain point, you got to go to down to the lower level at this point. But I tell you, even if we go down PCOR 2 with a lot of restriction, if the number continue to rise, and it keep going up the next week to 10 days or so, yeah, there's high possibility that we don't have a choice to go to PCOR 1 if the number keep going up. And this is where I tell you, we all are begging the community and follow the mask, the hand washing, the social distance, and it's a whole community that need to help us and contain this virus. No one don't want to go back, but you gotta remind your family, remind your neighbor, your friend that hey, respect this thing, because you affect the whole population of Guam here by your action. So we really have to pay attention. We need to help with our community and work together to try to help us not going back so far.
Right.
We come along, so we really need everyone's help at this point.
Doc, I know there's a lot of opinions on that physicians advisory group, but on the personal side, what's your opinion about which of the PCORs we should move back to?
we definitely, in my personal opinion, I'm not speaking for the whole package. We all have a different opinion, but we respect everyone's opinion.
Right.
You know, that we need to go back to two with some restriction because we know where the breakout coming from. So at a certain point, I think 2 or 3 weeks to save the rest of the economy is a worth thing to do. We don't want to be behind the power curve, which we are right now. We don't want to way behind and dig ourselves out the hole that um, we will suffer in the long run. So I think at a certain point, yeah, we need to be some people too with a lot of restriction.
Right.
Well, okay, so under P Core 2, what are some of the restrictions then you're talking about? You mentioned about the reducing the social gatherings from 25 down to possibly 10. What else are we looking at? The closure of like non-essential agencies or businesses?
Yeah, some of the business we have right now is nothing new that I don't mention. Some of the restaurant get hit hard. Some of the gym get hit hard. Some of the bar get hit hard. Some barbershop they get hit hard. So those are business that we have to look very carefully to see. Hey, because that's where people um, tend to gather. With their mask down, and that's where the infection started. So those area where we recommend a lot of restriction for those business, just because they had to kind of tighten up um, um, the guideline. It's not across everyone. I tell you, some of the restaurant really follow the rule. I love to eat out, and I eat out some restaurant already. And when some of the restaurant, I tell my heads to them, they follow more than the guideline we give to them. But I wish everyone do that to protect the public.
Hmm.
So
You keep saying restaurants, and earlier you said that there were clusters that were found, I guess, related to a funeral and a restaurant. Can you tell us a little bit more about these clusters that you referred to?
yeah, plus I mean that if we know there's a positive case come out of, let's say, that event, okay, and then we do all the contact tracing, what public health does, and when you contact the people and those people start to turn positive, that's a cluster. I mean,
Right.
it's like
I know. I think we all are familiar with what a cluster is, but I'm talking about. You mentioned there were clusters that were identified. One stemming from a funeral, and then the other at a restaurant. So this funeral cluster that you're talking about, we had the Chukis Association of Guam, I think Vice President Kos Nakamura on, and he was mentioning about a funeral that occurred within the Chukis community. And is this the cluster that you are referring to?
yes, I mean, there's one with the Chukis community, and then one with the local, funeral. So there's actually two funeral that there's a cluster come out with those. So it doesn't distinguish who you are,
Mm-hmm.
or race you are,
Mm-hmm.
So, but because at the funeral, that we see there's no mass at those funeral, and that's where everything kind of break loose. And you gotta remember when the people go back to the funeral, they associate with other people in the community also, and that's
Yes.
where we start losing contact just
Wow.
because now trees start to grow,
Mm.
and the brand are out there. So for everyone that get infected, remember they go to different places, they
Mhm.
see different people. So that's where you start losing the track of who you come in contact, who you give it to. So it's kind of dangerous when you
Yeah.
start. So it's like a tree.
I mean,
Mhm.
Doc, we have the governor's office is closed, the legislature is closed, the airport's closed, public health is closed. So yeah, we're definitely seeing rampant, widespread dangerousness. What about the restaurant cluster that you referred to? What can you tell us about that?
I mean, everyone talk about, we have some restaurants, I think Crust, and you have uh, a few restaurants down in Tumon that basically have also a cluster that coming out, and there's multiple people in those restaurants that positive, and then they go to bar, and now those bars that attend to also have some breakout as there's some multiple positive coming out the bar. So as you can see, when you go from one place to the next, um, it really you spread the virus out. So it's not just one place that you expose yourself to, but every place that you go, you spread the virus out to the people around you.
Mhm.
So I
You,
wish they.
you mentioned crust, and just by mentioning or saying they're restaurants, but are we talking about like events at restaurants,
Or just
like
regular,
a party, or just you're just sitting around and you're eating?
right? Because I mean, all it takes is one positive person to eat and then spread it. Then dinner and a drinks, and it seems like that's what happened. Is they went to dinner and then they went to drinks, and then who knows
Yeah.
where.
Like I was with like somebody within my household. I was eating dinner. I mean, that doesn't. That wouldn't be classified as a cluster, right?
Yeah.
Or was it like a party at a restaurant?
Yeah, there's no. The only one, the thing I know is a large gathering, but I don't know with that. That's under investigation by public health team. But I know that there's quite a bit coming out of that event. So it's like say everyone need to kind of follow the rule, so that way we prevent this from happening. I mean, we were doing 1 or 2, and suddenly I tell you, once you get one set of people get affected, it's going crazy at this point.
Right. Doc, you said that they lost track of the trace. So I'm really concerned, and we had public health on yesterday, and of course they're not going to say we're in over our heads. There's too much going on. We're trying to track this thing, and it just looks like a big scribble when we try to contact trace. So, in your opinion, do they have the staff to conduct? I mean, I lost track of how many investigations are ongoing when you look at the number of places that are closed down. So does public health have the staff to do these trace investigations, or do you think or has it reached a point, Doc, where it's so rampant that it doesn't even make sense to trace investigate anymore?
Yeah, it doesn't matter they have 1,000 people on the tracing team. It's really depend on the people that positive that give you the right answer, right? I mean, you're gonna meet person A, person B, person C, but when public health interview you, you say, "Well, I only meet this person," and you leave the 2 or 3 out. You really that trace, right? I mean, some people are not really want to tell you everything that everyone they come in contact with for whatever reason they have there. So that's what I mean by loss of contact, because I don't remember who I meet yesterday. I meet a lot of people yesterday, but I'm going to try to name everybody I meet. I'm going to be in trouble. I can't remember everything. So those I mean by the tracing are lost out there, because as much as public health will ask you a question, who do you come in contact with? You just can't tell everybody. I mean, you don't remember anyone that you meet. If you go to restaurant A, where the cluster is, and then you go to another bar, there's multiple people in that bar. And if you give to those people in the bar, you can't really remember who do you meet. So it's very hard for public health, to trace everyone. I know that they are overwhelmed or not, maybe, but it's not because the manpower or because they have too much. It depends on how much volunteer, how much info they get from the patient.
Right.
So just like I'm not picking the Chuukese community, but the Micronesian community overall in the United States, when they have the cluster breakout, it's very hard to get info out, to try to get contact tracing of who do you meet. Is it the language barrier, the culture? So public health have a lot of challenge to try to make sure that they get in touch with everybody that possibly have a contact with an infected person.
Doc, there
Maybe
was
they need to hire more some Chuukese interpreter contact
right.
trace investigators.
The governor reached out to even the governor in Chuk. They are at every level to try to get communication out there.
Right.
And we put out PSA in different languages.
Yeah. We actually have those from the Guam Medical Association, and they produce some PSAs, I believe in Chuukese and Pohnpeian.
Right. Doc,
so
there was a thing going around on WhatsApp, and people were posting it on Facebook, and it was like, if you have been to these places, and then it had a whole list of dates and locations. What do you make of people sharing that kind of info? And, is it unverified? What do we make of it? Because it ends up going around. But in a lot of cases, when this info goes around and we go and ask the government, they say, oh, it's unverified. Oh, and then we find out 3 days later, oh, it's actually true. So I don't know if you've seen this message, but it is a list of locations and dates. And, it says, oh, if you've been to this place, any of these places, these dates, please go get tested.
Yeah. There's always have, information leaks out in the community somehow. That's something that, when we put out the info out there, we have to be careful what we put out there, and with the JIG and with public health. But because you cannot just blur out everything there, but you have to make sure that you plan things accordingly. But somehow info leaks out before public health can get there or the JIG can get there, and they will need to be verified before they say yes. That's the true information.
Right.
But,
I guess it's just kind of frustrating, like Chris was mentioning, because you do see these lists, and then the only way of verifying it is you have to contact every single business on that list. But thankfully, there have been businesses that have just come forward and said, crust here, Proa.
And what I think we have to be careful about too is and I'm assuming that this list was somehow involved in maybe an investigation where they had asked somebody, hey, where'd you go from these dates? And because it looks like that's what it is, right? But just because I'm positive and I went into somewhere doesn't mean I spread it to everybody there. So I feel like it also creates a lot of undue anxiety and panic. But then again, when we don't get the info in a timely manner and it ends up going all around on WhatsApp, and then a few days later they're like, yeah, it was true. So people don't know what to trust. And I think again, it's information is so key, right, Doc, in this pandemic.
The information is out there. Need to be passed on adequately, so that way the public know, hey, if I go there, I should go get tested, get seen someone.
Right.
So that's something the community to participate on that one. But regarding school, guys, I know yesterday you mentioned about PCO 1 in school, and the governor is very straight. All the school should be taken cautiously. Public school, private school should be treated the same. I know a lot of private school spend some extra, fund just to make sure the kids are safe, and they do a lot. The Japanese school, own a private school, but I don't think we want to treat the public school different than the private school. All have to be the same level somehow. So when the decision of move to PCO 2 or PCO 1 that affect the school, what we recommend is that from right now until this thing's over, we just want to do online if possible.
Wow.
Because there's so many schools already. Either the staff get
correct.
Yeah.
And because we're seeing that, we're seeing like at FBLG and Simon Sanchez High School, people testing positive, right? Yeah. Is that something that you guys are looking at for the Guam Department of Education then to have employees and teachers tested?
One of our PAC member, recommended quite a while ago that before school started, that all just like TB, all the staff members had to be tested. I know this is somewhat a little bit different than TB, but that's a thought that, hey, should we test all the staff members before they go back to school, to prevent this from shutting down the school? And that's a possibility because we have enough testing capacity right now to do that. So it's something that the superintendent of, need to make decision. And if they request it, then we can work with public health to make it happen. At least, like I said, I mean, again, it's very hard to say because test is negative doesn't mean that you drop your guard, you go out there,
Right.
next day, so.
No, that's exactly what's happening though, Doc. Is people going to get tested, they're negative, like, all right, woo,
Yeah.
negative.
And we're going to be having this community testing. I know when we spoke with you earlier, we were talking about moving towards target testing, and then we see this press release late yesterday about community testing starting back up, starting in Jigo this Saturday and
tomorrow,
then right, and the next few Saturdays through
Good.
September.
Yeah, good.
Okay. This is what public health is doing. We talk about the target testing, right?
Yeah.
So I know a lot of phone calls. They had a huge amount of phone calls about people worried about their close contact or their possible exposure because this breakout we had in the past week or so, right? So those community testing it's a community, but really is the message out there for people that you think that you come in anywhere exposed or close contact, please go to those one. I mean, this is where they're going to put that net out there for people,
Right.
and the message is that you think you get exposed, if you don't have no exposure or something, stay home. Let the people that they think they're exposed to or they have a close contact, they have an ability to go to those, so that way, you can get tested. But they have so much phone call worried about close contact or possible exposure.
Mhm.
And those people we really, really highly recommend for them to go to those testing sites.
Mhm.
I know that the AMC, FHP, SDA, Dr. Dr. Gavin Clinic are also participating in those things, try to help public health and do the testing this coming Saturday.
Right. Yeah.
But I would say that if you think that you've been exposed to or you have close contact, please go there, and the rest of the people, just give those guys a priority because that's what we really try to clamp down on this cyclone, the virus at this point.
Right. Yeah, I was really happy about that, Doc, because we had really been pushing for that community mass testing, and the answer was we didn't have enough people. The answer was, oh, we're doing the targeted testing. The answer was we only did it the first time to placate the public. And then, the governor 180 from what the public health was saying yesterday on the show. She said, no, we're going to do a public a testing. But she had said they were going to do it towards the end of the month. So when the announcement came out that it's actually going to be this Saturday, I think a lot of people were just like relieved about that because we're getting just a ton of calls here and then on the on the personal line.
So you're saying that this community testing effort that's going to get underway, you're really looking for people that are experiencing symptoms to come, even though the release says anybody that, even if you don't have symptoms, to come and get tested. But really, it's for people who.
No, this one right here, guys, is that you don't need symptoms.
Right.
If you think that you exposed to somebody, you've been come in contact some at work or whatever that you think you have to do, you don't need symptoms. No, you got to go there. This is why they put it out there because there's so much phone call.
Right. Yeah.
A concern on I've been exposed or maybe my brother exposed to someone positive. So this thing right here is mean to try to catch everybody that concerned on the exposure in the past week or so. You don't need to have symptoms. If you think you have type of risk, go there. That's what it's saying.
Okay.
That's why they.
Really, though, I don't even know if I have been in close contact with anybody, so I might have to go and just get tested.
But can I ask something real quick?
Sure.
Because of this outbreak here, that's like Chris was saying, there's an overwhelming phone call concern, everything. So we really stretching the healthcare of one. Okay. So when you go to a clinic, or any clinic, the waiting time will be longer for you to get tested. So I really ask the public to be patient, be courteous to the staff at the clinic, because you know that's not their job, but they are doing extra to make sure our community get the help. Beside taking care of their own patient.
Right.
So
Mm-hmm.
don't be patient. Don't get mad to the staff because you wait a bit longer. Because trust me, they are stretching to the max to try to make sure that you have. And sometimes you have to wait an hour or two. But you know, they trying. We are really stretching. The community and try to step up here. So you need to put the message that be patient
Right.
and be courteous.
Right on. Doc, you mentioned that you guys, the clinics are going to be involved in kind of augmenting this community mass testing. Does that mean you guys are going to be doing any kind of drive-through testing this weekend at the clinics?
Yeah, but public health will divert people to the tier 2 and certain tier 3 clinic to help out, because they're gonna expect a massive amount of people, and the line will be very long. So all the tier 2 and to the tier 3 clinic are also will do the drive-through, just like public health and GIGO, as they divert to the site.
I see. Okay. Yeah,
Yeah,
and the northern part of the island, that's where you see, according to the SIT report,
Right.
a really large amount of positive cases. So again, GIGO Gym this Saturday, 9 a.m. to 12 noon.
We got to move on to
They
the.
do a lot. I know we talked on the pack yesterday. We're going to ask for the guard member to help direct traffic in the clinic setting, just because we're going to expect beside the clinic some appointment, they're going to also add up to this drive-through too. So you're going to take an extra task on top of what they're doing. Just because, like I said, there's so much phone call. That we have in a typical day for us now. We swap over 100 people every day.
Wow.
For up our appointment, and that's where you kind of wear your staff down very quickly.
Yeah, and that's not just
Remember-
COVID. I mean, you guys are dealing with all the chronic illnesses and everything else that Guam. I mean, God, we've got diabetes, hypertension, all that stuff that people have been putting off for this pandemic. And so, yeah, the clinics it's just crazy. Doc, we really got to shift over to the schools. A lot of parents, watching, listening, want to know what's going on with the schools. I want to give you the floor, a close here, message to the public. A lot of people listen to what you have to say, Doc. So what do you think are the most important things that the people of Guam need to know this morning?
Yeah, for everybody in the community, I mean, we really ask people to follow the guidelines, the mask, the social gathering, the hand washing, the social distancing. We need your help to not going backwards so much. We come a very long way at this point. If the people in your immediate family, you don't have a choice. Your mask will come off when you're at home, but if you're going to have a gathering with the relative that don't live in your same household good, your friend, you got to take extra precaution, because you do not know where those people have been in the past, and you might take the virus back to your family. And that's something that we really need to ask you, to really be vigilant about this. Just like the governor is saying again, this virus is a big
bitch.
B.
Say it, Doc. Come on, Doc.
Say it.
Right, so you have to be careful. So
I'm sorry, what did you say?
What was that?
It's a big B, Sabrina. My kid got a.
The classy guy.
Okay, but take care, guys, and be cautious and be careful. Okay.
Thank you. Yeah. You
All
too,
right,
Doc.
take care, Doc.
You be safe.
Bye.
Maybe we'll see you at the press conference 11:30.
Okay, we try.
Right. Okay, Doc. Be safe. We'll talk to you next week. Okay. All right. Wash your hands.
All right, there's community testing this Saturday, GIGO Gym, 9 a.m. to 12 p.m.